Hey everyone, let's jump right into this explainer. We're going to explore the meticulous, surprisingly forensic world of exactly how we measure human pediatric growth. It kind of seems like just having a kid step on a scale or stand against a wall, right? But in a clinical setting, literally every single millimeter and gram matters.
So here's our roadmap for today. First, we'll look at weight, length, and standing height. Then we'll move into measuring vital body circumferences. And finally, decoding normal pediatric growth.
All right, kicking things off with Section 1, weight, length, and standing height, the absolute foundation of growth. Okay, rule number 1, spring balances are totally out. If we want true precision, we have to use a lever or electronic scale, and we're capturing a child's weight in minimal clothing right down to 100 grams. To put that in perspective, 100 grams is roughly the weight of a standard deck of cards. You want the child perfectly centered in the weighing pan, and I really can't stress this enough, always correct for zero error before you start. It is the baseline of the baseline. Now, a child's age completely flips the script on how we measure them. For infants under 2 years old, we measure their length lying completely flat. But once they cross that 2-year mark, we switch to standing height. It makes sense, right? The method has to adapt as they develop physically. So making sure we grab the right tool, an infanometer for the babies versus a statiometer for the older kids, is absolutely crucial to avoid skewed data right out of the gate. When we're measuring an infant lying down, the mechanics are incredibly strict. It's almost like a giant puzzle. Head held firmly against a fixed board, knees gently straightened out, feet kept right at a 90-degree angle to the legs, with toes pointing straight up. Then, we bring a free footboard into firm contact with their heels. Oh, and those flimsy cloth tapes you sometimes see on soft mattresses? Avoid them like the plague. We need a rigid table to get this right. For standing height, we use this really fascinating concept called the Frankfurt plane. Basically, the child needs to look straight ahead, aligning their ear canal perfectly horizontally with the lower margin of their eye socket. Actually, think of it like an invisible laser level going from the ear to the eye. If they look even slightly up or down, the whole measurement is thrown off. This imaginary horizontal line is the secret to getting their head perfectly level every single time. And along with that perfect head tilt, their heels, buttocks, and back absolutely must be touching the vertical surface. Heels slightly separated, weight perfectly even. Oh, and here's a fun little detail. The headpiece has to be kept firmly over the top of the head to actively compress the hair. Because, if we don't squish the hair down, we aren't measuring the child's height. We're literally just measuring their hairstyle. Every little detail is controlled. Moving right along to Section 2, measuring vital body circumferences. Because every millimeter truly tells a story. Taking a quick look at our clinical toolkit, I want to highlight something huge. Notice how a non-stretchable tape is the absolute gold standard for circumferences? Think about it. If your tape stretches even a tiny fraction over months of use, your data is instantly garbage. We also use a very specific crossed tape method to take these measurements, and we're going to see exactly why that matters so much right now. Let's start with the head. We're looking for the absolute maximum circumference here. To find it, we anchor that non-stretchable tape on specific bony landmarks, the bump right at the back of the head and the ridges just above the eyebrows. Then we apply firm pressure using that cross tape method to make sure we're compressing the hair and getting a solid, consistent number. Now, measuring the chest, that is literally like catching a moving target. You have to wrap the tape exactly at the level of the nipples, but here's the kicker. You need to capture that measurement precisely halfway between a breath in and a breath out. It takes real patience and perfect timing because breathing obviously changes the chest dimensions second by second. And for the mid-arm circumference, there is a strict 5-step process. First off, we always use the left arm, hanging relaxed by their side. And we don't just eyeball the middle. We find the tip of the shoulder bone, locate the tip of the elbow bone, and physically mark the exact mathematical midpoint between those two spots. Only then do we measure it using our crossed tape technique. So after gathering all these obsessive, hyper-specific measurements, literally down to the millimeter and the hundredth of a kilo, it begs the question, what do we actually do with all this forensic data to figure out what normal pediatric growth is? That brings us to Section 3, decoding normal pediatric growth, where we look at the macro picture. Here's the thing you have to take away from this. Normal is absolutely not a single magic number. Instead, it's defined as a permissible range of variation, usually sitting between the 3rd and 97th percentiles on a growth chart. These charts are built from the average readings of a massive group of healthy kids. So we aren't expecting every single child to hit a dead center average. We are completely allowing for natural genetic variation. Most kids will happily ride along their own specific curve on that chart. But if our precise measurements suddenly show a significant deviation, that's a massive critical alarm bell. If a kid has been tracking on the 50th percentile for years and suddenly plummets or spikes, it usually points to recent illness, overnutrition, or undernutrition. That's when our hyper-obsessive data collection really pays off by catching hidden health issues. We also have a really important rule for premature babies. To be fair, the math requires a strict prematurity correction. We literally subtract the amount of time they were premature from their chronological age, so we aren't unfairly comparing them to full-term babies. But clinical standards dictate that this correction factor completely stops once they hit their second birthday. After 2, they are on the standard timeline. Which leaves us with this final thought. We've seen how every millimeter and every gram holds a vital clue to a child's developmental future. It's not just taking measurements. It's constructing a highly precise, data-driven map of a human being's health. So, are we paying close enough attention to the absolute mechanics of growth? Because getting it right at the micro level is the only way we can unlock and protect their macro potential.